Good morning. I want to thank you all for joining me at Cook County Health today. With me at the podium are Dr. Ponni Arunkumar, the Cook County Chief Medical Examiner, Dr. Stephen Axe, Division Chair of Emergency Medicine and Toxicology at Cook County Health, Dr. Julie Nowinski-Konchak, Physician Lead for the Medication-Assisted Treatment Program, Cook County Health. And I'd like to thank Michael Albert, who is our sign language interpreter. This year continues to illuminate the dangerous consequences we face as a result of centuries of racial inequity. While much of this year has been consumed by our fight to contain COVID-19, which has disproportionately impacted communities of color, we've had to contend with skyrocketing homicide rates, which almost universally took the lives of Black and brown people. And we also face an exponential increase in opioid overdose deaths. Dr. Arunkumar will break down the numbers for you, but here are the sobering facts. We're on track to double the number of opioid-related deaths we saw last year. African Americans make up 24% of the county's population, but half of the overdose opioid deaths this year. Once again, whatever crisis faces our communities, people of color bear the brunt of it. We're here today to sound the alarm. Our county and our nation are facing a number of alarming challenges. The victims of the opioid epidemic have been quietly dying around us. We must be their voice to prevent future needless, preventable deaths plaguing our community. At a time in our history when we're experiencing the loss of so many lives, we must act now to decrease the rate of opioid deaths. These compounding public health crises show the existing inequities in our system and their disproportionate impact on communities that already struggle with disinvestment, lack of resources, violence, and poverty. With that, I invite Dr. Arunkumar, Cook County Chief Medical Examiner, to give us details on the scope of this crisis. Dr. Arunkumar.
Thank you, President Preckwinkle, for your leadership. Never has your support of our office been more critical than in this extremely difficult year. And I thank Dr. Axe and Dr. Nowinski-Konchak for the work you do every day to care for some of the county's most vulnerable residents. Our office is one of the busiest in the country, second only to LA County. In an average year, we handle approximately 6,300 cases. Last year, we had 6,274. Today, just 6.5 months into the year, we are at over 8,900 cases. We will crest 9,000 in the next couple of days. When our caseload first started to accelerate, we were focused on COVID-19. The assumption was that the rise was attributable to the pandemic. But when we began to look deeper into the numbers, we realized the virus did not account for the entire dramatic increase. That's when we began more closely scrutinizing opioid overdoses in Cook County. The numbers tell a grim story. Last year, the Cook County Medical Examiner's Office confirmed 605 opioid overdose deaths between January 1 and July 13. This year, that number stands at 773, but that only tells part of the story. We also have 580 pending cases. We know that traditionally 70 to 80% of those cases will wind up being ruled as opioid overdose deaths. This means that there are 400 to 465 more opioid deaths thus far this year. Realistically, just 6.5 months into 2020, we already have more than 1,200 opioid-related deaths. As a point of reference, last year the Medical Examiner's Office confirmed 1,267 opioid overdose deaths. In 2018, we confirmed 1,148. While the sheer number of cases is shocking to us, many of the other characteristics we see in this opioid crisis are not surprising to us, although some may be to you. The victims are overwhelmingly people of color. Of the 773 cases confirmed this year, 63% are Black and Latino. 45 to 55-year-olds are most likely to succumb to an opioid overdose, and the 55 to 64-year-olds are second most likely to die from an opioid overdose. These age groups have consistently been the most vulnerable to opioid overdose deaths over the past few years. Males are exponentially more likely to die of opioid overdoses. Fentanyl is the culprit in the overwhelmingly majority of these cases. The majority of victims are on Chicago's west side. That includes Austin, East Garfield Park, and the West Garfield Park neighborhoods. As I've said before, our office is used to dealing with death. It is our life's work. But we'll never get used to the tragedy that each death represents. While we concentrate on our mission to establish the cause and manner of death for cases that fall under our jurisdiction, we do not accept that they had to occur. The deaths we deal with in our office are by and large preventable. That is how we approach our work. If we are able to pinpoint how a person has died and are able to share that information with our partners in public health, healthcare, and in law enforcement, perhaps we can find a way to keep more people alive. That is why all the information I've provided to you this morning is available in the medical examiner's case archive on our website. President Preckwinkle has always stressed transparency, and our office has done all we can to make our data available to those who have a stake in the safety and security of our residents. Knowledge is power, and we want to empower our partners in healthcare, law enforcement, and our residents to use this powerful data to ultimately find solutions to avert these preventable deaths. This is an extremely difficult year for our community. Our staff sees firsthand what most only see from the safety of their homes while watching the evening news. I'm extremely grateful for the work that the staff does every day. We take our responsibilities seriously. We are the last healthcare professionals to care for these patients, and we treat them as we would want our own family members to be treated. Thank you. I invite Dr. Axe to come for some comments.
Okay, good morning.
Good morning.
I'm Dr. Stephen Axe. I am an emergency physician, and I'm also the director of toxicology at Cook County Health. I'd like to thank President Preckwinkle and everyone supporting Cook County Health in addressing the opioid crisis. I also like to thank all my colleagues here today for their outstanding collaboration and partnership. Although there's been a 50% increase in opioid overdose fatalities, there has not been an increase in number of people coming to our emergency department for help. This means that people are not coming to the emergency department or hospital at the point of crisis. This is very important. We've actually seen a decrease in the volume in the emergency department since the beginning of the pandemic. What we'd like to say is that it's safe here. That's the most important message. This is extremely alarming with respect to the opioid overdoses because for each EMS run that a paramedic brings a patient to the hospital, if they make it to our care, they will likely live. And that's very important for individuals to know. If the patient's given naloxone in the ambulance or at the scene, they will likely survive. Opioid overdose deaths in the emergency department is a rare event. The dramatic increase in number of deaths due to opioid overdose is unacceptable. Due to the pandemic, we initially asked individuals to stay at home unless it was an emergency, and overdose is such an emergency. We want to remind everyone to call 911 in an emergency and that it's safe to come to the emergency department in time of crisis. One phone call and ambulance ride could save a life. Once a patient makes it to us in the emergency department, there are so many pathways to treatment. We provide naloxone to patients, and due to the pandemic, we've partnered with our addiction medicine colleagues, and we can provide medications for 2 weeks, medications including buprenorphine. We connect these individuals to outpatient care through our medication-assisted treatment program at Cook County Health. which Dr. Nowinski-Konchak will be talking about. Because we have so many touch points throughout the Cook County health system, in our community health centers, in our emergency departments, in the inpatient units, and the correctional setting, the health system is in a unique position to help tackle the opioid epidemic from a variety of angles. We do not want people to be afraid to come to the emergency department. We are here to serve everyone. Okay.
Thank you, Dr. Axe, and thank you, President Preckwinkle and all my colleagues. The number of opioid deaths in Cook County, as reported by Dr. Ponni Arunkumar, Cook County Chief Medical Examiner, are staggering. Addiction to heroin and other opioids is a public health crisis with devastating consequences for our community. Cook County Health has a track record of providing patient-centered, evidence-based care for opiate use disorder that includes medications for addiction treatment, recovery support services, and addressing the physical, mental, and social health needs of our patients. The Medications for Addiction Treatment program at Cook County Health is a combination of FDA-approved medication and patient-centered behavioral health support, and it is considered the gold standard approach for substance use disorder treatment. As a physician lead for the program, I work across departments with wonderful colleagues to implement access to high-quality, team-based substance use disorder care within Cook County Health's numerous care settings. The pandemic has changed everything from how we interact with each other, where we can go, and also how we practice medicine. We continued to provide care and access to medications through telehealth visits, while residential programs saw huge service disruptions due to concerns for congregate settings. During the pandemic, we at Cook County Health saw a 20 to 25% increase in patients reaching out for help and engaging with us for substance use care. We're working to keep patients safe by breaking down barriers to access through telehealth visits, frequent team engagement and outreach, access to naloxone for overdose prevention, and longer prescription supplies to avoid disruptions in care. Our team-based accessible care is available in all of our 14 adult-serving primary care clinics, as well as at CIRMAC Health Services. We have a long history of serving a vulnerable population, and we see every day the toll this crisis is taking on them. Through a new collaboration with Chicago Recovery Alliance, individuals can present at any of their community-based harm reduction and syringe exchange vans and be connected directly with Cook County Health to initiate medications and care over the phone. We also will begin dispensing naloxone at our clinics. While many places across the country are starting to relax physical distancing restrictions, the pandemic is not over. Access to services has been and may continue to be severely impacted. Cook County Health has adopted how it is caring for patients with substance use disorders. Regionally, we need to better understand who is reflected in this uptick in deaths and how to best reach them. Thank you.
All right, thank you very much. And I want to acknowledge Dr. Kiran Joshi, who's co-leader of the Cook County Department of Public Health, who has joined us should there be questions related to public health. Alice, is that Alice?
Yeah.
Okay, do you have any questions?
Yeah, so I was wondering, a lot of these spikes coincide with COVID, but we're finding that...
Can you speak up a little bit?
Oh, yeah, sorry. So a lot of these spikes coincide with COVID, but we're finding that opioid overdoses also spiked in January and February before the stay-at-home order. So I'm wondering if you know whether this is true and what might have contributed to those spikes.
All right, the question is, if opioid deaths were spiking in January and February before the stay-at-home order, anybody want to speak to what might be contributing to that? Dr. Arunkumar, good. Somebody's going to speak to it. Thank you.
Historically, usually during the winter months, we do see a spike in opioid overdoses, so that may be one of the reasons that there is an increase in January and February. People are at home, so that's something that we've seen over the years.
Thank you.
All right, so I guess the answer is opioid deaths are seasonal, and so they usually see an uptick in the winter. It's just that we've seen a tremendous increase beyond that, huh? Okay, Alice, do you have any more questions?
Yeah, I also noticed a lot of the spikes coincided with increases in gun violence deaths. both in January and February and during later months. Do you think it's possible that these two crises stem from similar causes?
Desperation and hopelessness. Yes, those are similar causes. If you look at opioid deaths and if you look at shootings and murders, if you overlay them, right, it's the same communities.
Thank you.
All right. Anyone else on the line besides Alice?
Hi, this is Rachel from the Sun-Times.
Oh, hi, Rachel.
Hey, can you talk about what community-based efforts Cook County Health as well as the county is doing? It seems like, obviously, you want people to come into ERs, but is there any sort of outreach efforts going on to help people know what resources are available to them at the community level?
All right. Anyone want to raise their hand? Go ahead.
Sure, hi. So I'll expand on what I mentioned in my remarks. Cook County. Sure, I'm Dr. Julie Nowinski-Konchak, addiction medicine here at Cook County Health. So when the COVID pandemic started, we started talking with some of our partners who have firm outreach and availability within the community to see how we could better increase access to care without requiring people to come into clinic or the emergency department at that time. And we worked with Chicago Recovery Alliance, which is one of the, a national expert in harm reduction and overdose prevention, and created a mechanism where an individual who might show up at they have vans that circulate throughout the west side and the south side and throughout the whole community, and offer syringe exchange, hepatitis testing, HIV testing, and access to care. And we created a system where somebody could show up at their van and be directly connected with us over the phone to initiate care. So we wanted to, spread through partnerships, spread our ability to help people access the services that we provide where they are, right? Meet them where they're at. So that's one example of how we're partnering.
Thanks, Dr. Nowinski-Konchak. Kieran Joshi, Cook County Department of Public Health. So just two things when it comes to preventing opioid overdose deaths. One, it's, I think, really important for as much naloxone, or the medication that's commonly known and understood to prevent, or rather reverse, opioid overdose deaths. It's important to blanket the community with as much naloxone as possible. And we're in the process of building partnerships with law enforcement to make sure that those first responders are armed with the naloxone that they need to reverse overdose deaths in the field as they happen. The second piece is linking individuals to treatment. And again, we're in the process of partnering with law enforcement to make sure that there are systems and processes in place to make those linkages. More information to follow on that. This is just some of the preliminary work that we've started to do. Thanks.
Thanks. I have two follow-ups, I guess, on that.
Sure, Rachel.
Can you talk about then how much, or how would you quantify how much naloxone is already out in communities? Like, does every community have, I don't know, like, enough for maybe 2 or 3 people, or what metrics, I guess, are you using to make sure that communities are blanketed with that? That's my first one.
All right. So the question is, how do we determine whether communities have sufficient supplies of naloxone?
I think the simple answer to that question is not nearly enough. Naloxone, while it's not cheap, while it's not super expensive, it's not cheap either. And so what we found is that communities, often the communities where we see the most overdoses happening among the most vulnerable populations, do not have the naloxone that they need. So this is a significant need. Thanks.
Thanks. And then my last one, if I may.
Sure.
Obviously, this is a hammer and dance. We shut things down, we open them back up. Cases seem to be on the rise here.
All right, just a second. Hey, Rachel, I can't hear you. I have old ears and I can't hear you very well, so you got to slow down and speak up.
Sorry, will do. Cases are on the rise here, as well as around the country. How concerned are you that we may see these opioid overdoses continue to rise and maybe even triple from last year, or be just way worse than we're seeing before?
Well, I think at a previous press conference, we said, Dr. Arunkumar, that we've already had more deaths in Cook County by the end of May than we had in the entire year last year. So we got to the end of May, which is the 5th month, and we had more deaths in Cook County than we had in the entire year in 2019. And that's natural causes, that's the pandemic, that's street violence, and that's opioid overdoses. So it's all of those things together have had a devastating impact on the health of our communities. And I guess we can anticipate that, first of all, Dr. Rubin and Dr. Joshi have continued to remind me that it'll be a while before we have a vaccine. I think in the beginning of the pandemic, they were telling me that if we were lucky, it'd be 18 months. Where's Dr. Joshi? Is that right? Yeah, if we were lucky, it'd be 18 months. So that puts us in mid to late next year. And I think we can anticipate that we will continue to see, if not the magnitude of deaths from COVID-19 that we've seen this summer, but an uptick in the fall, an echo or a second wave. And as you have seen, we continue to struggle with the violence, particularly in the streets of Chicago. And we're here today to talk about the opioid overdose crisis as well. So the pandemic continues, and the violence continues, and we continue to see the overdoses. I'm not sure anybody can predict what the exact magnitude of the challenge is going to be, but it's already pretty serious. Anything else, Rachel?
Thanks. No, that's all for me. Thank you.
All right.
Hi, this is Melissa from ProPublica.
I'm sorry,
Can you
this
hear
is?
me? This is Melissa from ProPublica.
Melissa. Thank you, Melissa.
Yeah, so I'm interested in knowing how much money is being, I mean, Dr. Joshi just said that there isn't enough naloxone out in the communities that need it. Is the county putting more money into this? Does this press conference also indicate like an increase in investment in this? And could you quantify spending, I guess, last year versus what you expect to do this year because of the spike?
Dr. Joshi, you want to respond to that?
So certainly under the leadership of President Preckwinkle, we've been able to devote resources to addressing the opioid overdose death, the crisis in opioid overdose deaths. The dollars that we're going to be using to purchase naloxone that I referenced earlier are coming from a grant to us from the Substance Abuse and Mental Health Services Administration, and it's going to be complemented by grant dollars from the state of Illinois. Thank you.
Do you know how much money that is? Like, is it significantly more than what was spent last year on this?
Yes. So this is a new program and the grant began, I believe, in September of last year. I don't have an annual amount for you, but I believe it's we're going to be getting a total of $5 million over 4 years.
Okay, and then going back to the spike that predated the pandemic, I just heard that it might be a seasonal thing. The numbers, I just want to clarify that. The numbers are significantly higher in the confirmed deaths when looking back at previous January's, February's, December's, November's. And I mean, at the same time that the numbers were increasing, more of the deaths, there was fentanyl in the toxicology reports. Are you sure that it's just a seasonal increase that predates the pandemic, or can we say that the increase did start months prior to the pandemic?
Usually we do see an increase in the winter months, but as you can see, the numbers are much higher this year compared to prior years. We saw a huge spike in 2016, and then it has kind of plateaued, slowly increased. This year, again, we see a huge increase, and you can see that data. I mean, some of the increases right before the pandemic could be related to that seasonal increase, but the increase in the numbers, yes, there could be other reasons, and that's one of the reasons we put this data out, is for people to look at what may be happening.
Thank you.
This is Kristen Schorsch from WBEZ.
I'm sorry, it's Krista.
Kristen Schorsch from WBEZ.
Okay, Krista.
Yeah, hi. Hope everyone's well. I just had a quick question. It's maybe a little what Melissa was asking too. I just wondered, are there other reasons of what we did attribute to this increase in overdoses? I mean, are we thinking that is it just that people aren't seeking help because of the pandemic, that they're afraid to go to the hospital, they're afraid to go to the doctor? Because I would also think that if people aren't leaving their homes as much, then they wouldn't maybe have as much access to opioids. So I'm kind of wondering, what could be some other reasons that you all are attributing to this big rise?
Dr. Axe.
So I think one of the perspectives I have is the why of opioid use to begin with. I think it ties to, as President Preckwinkle said, hopelessness, lack of support structures, and stability. I think the pandemic exposes all sorts of structural inequalities in our society, and people who have a propensity for substance use disorder are very much more at risk for relapsing or using more. So that's the way I interpret these data. I think that we should really appreciate the why of why people are attracted to substances. I guess the other point about the fatalities, realize that the encounter with a physician, these predominantly in Cook County are street drugs. So these are not drugs that folks are getting from their physician. We do not have the degree of a pill problem as other parts of the country. So what we're seeing is individuals are using predominantly street drugs, which have never been more dangerous than in the past couple of years with all the fentanyl analogs.
Okay, thank you.
All right, is there anyone else on the line that we missed? Okay, Alice, do you have any further questions?
Yeah, so I was wondering, have you spoken with other counties in the U.S., and can you speak to how Cook County is comparing with national trends in opioid deaths?
I haven't spoken to anyone else. Anyone had any contact with their colleagues elsewhere in the country? Dr. Arunkumar?
I just have some contact with the coroners in the collar counties in Illinois, and they are seeing an increase in the number of opioid deaths that they were compared to what they were seeing before.
Okay, thank you.
Okay. Rachel, did you have any further questions?
I don't. Thank you.
Melissa? Kristen?
I guess,
Melissa?
do you think the county is doing enough, or can we do more?
We can always do more. We're doing the best we can. Ms. Zorich?
I guess I have more of a reimbursement question. I know this is probably more of a state question, but I'm just wondering, over the years, a lot of mental health providers, addiction treatment centers have sounded the alarm on the fact that their reimbursement rates are pretty low. So it's really hard for that to provide a lot of treatment for folks. And with COVID, they had to shut down or limit access to residential programs, for example, so that they didn't spread the virus. So I guess I'm wondering, is there any thought to helping, on that front? I know that Dr. Joshi talked about the grant funding to get more naloxone out into the communities, but I wonder for the addiction treatment centers and mental health providers, is there any way to, any talk of helping them financially to have access to more treatment?
Okay, go ahead.
This is Julie Nowinski-Konchak. I would just say that the state received a grant from CMS to explore barriers to treatment for substance use disorder for Medicaid beneficiaries, and that is an opportunity that Cook County is involved in to explore reimbursement and other barriers. I think we should all reflect and recognize that at the end of the day, pre-COVID, there wasn't enough access to evidence-based treatment, which is medication plus support, and that got worse, right? That was worse during COVID, and so, and that's still the situation. When somebody can go to an Illinois prison and have their life-saving medication stopped for this medical condition, that contributes, right? When someone can go to a recovery home and be told they aren't allowed to continue that medication, this contributes to the overdose crisis. So that's where we can all think regionally and support ourselves regionally to create access points to evidence-based care.
Okay, thank you.
Okay. Are there any further questions? I think I went through the list twice here.
Can I ask one more question? This is Alice.
I'm sorry, who is this?
Alice,
Alice, okay.
what resources and government policies would you like to see from the federal or state level to combat this crisis?
Okay, the question is, what resources we'd like to see from the federal government? Anyone want to speak to this?
I'll make a couple.
Good.
Okay, yeah, Dr. Steve Axe. Again, I wear both hats as an emergency physician and as a toxicologist. So I can say on the front lines of the pandemic in the ED, I think my colleagues nationally are very concerned about PPE, which I think has become a term everyone knows now. If we do see second, third waves, this is going to be critical for our ability to take care of everyone that comes in. We would like to see that we keep a close watch on our surge capacity. We have excellent disaster plans here, but we need resources to fill that gap. I think federal assistance, providing naloxone, as Dr. Joshi mentioned earlier, we need to saturate the community with that resource. I think locally we're actually in pretty good shape in terms of emergency response, but we'd like to see this augmented by a coordinated federal response. The Strategic National Stockpile is a resource that really should be prepared to distribute these resources all over the country.
Thank you, Dr. Axe.